when it comes to, veneers or crowns or any sort of anterior or cosmetic work, it's almost more art than it is science. Um, the prep is very important, where we prep the teeth and all of that stuff. But I think, a lot of dentists, most dentists aren't making their crowns or their veneers in-house. They're, taking impressions, or in our case, we use a scanner. And this big, not a lot of people like having all that impression material in their mouth. Yeah, it's not fun, right? So, but what we do is, we send all that stuff to a lab, and the lab makes, you know, in most cases they'll make a wax up that we can use as their temporary, that the assistants can kind of use as a guide when we make our temporaries. But then when we get the final product, they also make that as well. And so I think that's a very important part, um, of the process. So what we do, we both use, we use different ones, and there's times where we'll bounce back and forth, but a lot of times for our anterior cases, we use local labs. And that's for two reasons. A, because they're a lot easier to communicate with, and B, because we can send patients there and get a custom shade, which is very important. Otherwise, when you send other places, it gets very technical. Like I said, it's an art. So you have to take pictures. You have to have a really good camera. When it comes to shade, you got to have a certain type of lighting, all that stuff. Because if not, it gets into the lab and it doesn't kind of come out right. Then you got to send it back. Whereas easy with us, what we can do is a lot of times for our big cases, or even especially for our single cases, because those are the ones that have to match even better, right? When you do a full case, it's easier. If things are off a little bit, they're all matching at least. But with one, you can get kind of tricky. So what we can do is we can send you like, hey, we'll cut this crown, we'll put you in a temporary, but you go straight over there. He'll shade match you in his office, perfect. So that way when it comes back, we know it's going to have a good shade. And so I think that's a huge part of it. Like I said, there is a science part of it. Obviously, you go to school for a long time, we learn how to do all this stuff, but art is a huge part of it when it comes to cosmetic dentistry. And I think lab is very, very important.